Hi, I'm Dr. Moore at Lone Star Animal Hospital, and today we're going to answer a few common questions that we get about dog dental disease. So I've got some questions written down. Someone's going to throw those at me, and hopefully we can get some of these answered for you. What's our first question?
What are some signs and symptoms of dog dental issues?
Probably the most common thing that we hear owners bring to our attention is bad breath, halitosis. Of course, dogs are always giving kisses. It's very easy to pick up on. It absolutely can be a sign that there's something going on in your dog's mouth. You might also notice some bleeding. Maybe if they're an aggressive chewer, like on a rope toy or something like that, that can be a sign that there's some periodontal changes, gingivitis, inflammation in the mouth, something that might be of concern. Those are probably the two most common things that you're going to notice at home.
The veterinarian looking for during a dentistry examination on a dog?
So during a physical exam, when we're looking in the mouth, I'm looking for signs of periodontal disease. The first stage of periodontal disease is gingivitis. So that bright pink line that sometimes will pop up right at the margin where the gum meets the tooth. And that is inflammation. And if there's inflammation there, we're setting up for inflammation further deep down underneath that gum line, and eventually the bone that's holding those roots in is going to start to recede. And that's an irreversible change that we're really trying to prevent. So that's just an advanced stage of periodontal disease. That's what we're looking for mainly in an otherwise healthy mouth. Absolutely, we're screening for fractured teeth, dogs that are really aggressive chewers, or get hard chew toys like bones or nylon bones or something like that. We're looking for anything that's painful or infected.
What are some possible dog dental treatments that you would use?
So oftentimes if we see periodontal disease or any kind of disease in the mouth, we're going to recommend a full dental assessment. So typically that's under anesthesia, and there's a lot that goes into that. Not only, yes, we're going to clean the teeth, we're going to scale and polish and make the crowns look nice. We're going to get underneath that gum line with an ultrasonic scaler and address that underlying periodontal disease. But what's maybe the most important is we're going to look with dental x-rays and we're going to probe, and we're going to look for deep pockets. We're looking for an infection that's hiding under the gum line that's causing discomfort to that dog, and those are the teeth that potentially need to be addressed, maybe with an extraction, maybe with some sort of other periodontal treatment. All depends what we find in there. So
if oral surgery is needed for my dog, what should I know? How should we prepare? What should we expect?
Yeah, sometimes we can be at least on the lookout during a dental and say, hey, this tooth looks fractured. I think we're going to have some pulp exposure. It may be time for this tooth to be extracted. I'll know a whole lot more once I get in that mouth. And so what I'll do is after I've got all my questions answered, I will call an owner during the dental and give them the full rundown of what I'm seeing, make my recommendations. If there are teeth to be extracted, honestly, I only make that recommendation if that is going to help the dog in the long run. We want to get rid of pain and infection in that dog's mouth. And so sometimes extracting the tooth is just the best thing. And then they are so much happier with that tooth being gone if that's the case.
What if periodontal disease sets in? What's the reality of that there?
So periodontal disease is a progressive concern. Once it starts, it's going to continue. And honestly, just like in people, there's genetics that absolutely play a role. So not every dog is going to have the same progression. So some dogs really need to get in there and have their teeth addressed, periodontal disease addressed, about every year. Other dogs could go maybe 2 or 3 years. And part of that depends on home dental care. If owners are able to brush teeth at home, that's really the best way to slow the progression of periodontal disease.
How can dental disease make my dog sick in other ways? What effect does just tartar and plaque have on my dog's overall health?
Yeah, so there's absolutely going to be bacteria that's harbored underneath that bacteria and plaque. And if we're seeing plaque, tartar, even mounds of calculus on the crown of the tooth, there's absolutely more of that hiding underneath the gum line that we don't really see. And so, infection, inflammation, all of that can be uncomfortable, but it also is something that the immune system has to deal with. So those are the things that we want to address when we're looking in the mouth. We want to find those painful and infected teeth. All right, those are some of the more common questions that we've been asked. If you've got another question or you want to talk more in depth about dog dental disease, please give us a call.